Hey guys, I'm Mahesha and welcome back to my channel Dr. M Inspires. I'm an international medical graduate currently working in Australia, and this video is going to be a continuation of a series of videos that I have done before. And if you are very familiar with my channel, you know that I have done two videos about the interview process for junior doctors here in Australia. In my previous videos, I have discussed about understanding the interview process and also how to structure when you answer questions regarding personality based questions. So, in today's video, I am going to talk to you about how to answer the clinical questions in a junior doctor interview. So, what we need to understand here is that clinical questions are not asked in an interview to check how clever you are. So, basically, what they want to assess by asking clinical questions is that if you are safe, if you are structured, and if you know when to ask for help. And many IMGs, they lose marks not because they don't know medicine, but because they don't know how to make the interviewers happy. What are the key points that the interviewers will be assessing when they ask you these clinical questions? Number one, can you recognize a sick patient? Number two, do you know to prioritize ABCDE approach? Number three, do you know how to act within your level? Number four, do you know to escalate appropriately? And number five, do you know how to communicate clearly? So, in short, they want to know, can we trust you at 2 a.m. on a night shift? Let's look at a sample question. You are the doctor on the night, and you're the resident, you're the only resident on the night, and almost close to midnight, you get a 68-year-old gentleman who is brought in by ambulance with a 8 out of 10 chest pain. So he's got a background of hypertension and dyslipidemia, and also his mother passed at the age of 55 with an acute MI. So let's look at an answer a typical IMG would give. This patient could be having a myocardial infarction, pulmonary embolism, aortic dissection, or pericarditis. I would ask detailed history about the pain, do a complete cardiovascular and respiratory examination, send blood tests including troponin, D dimer, full blood count, a Chem20, a CRP, and also arrange a chest x ray and a CT angiogram if required. I would start aspirin, statin, beta blocker, and nitrates, and then review the patient once the results are back. Now let's look at the example answer number two. With a patient presenting with severe chest pain, my immediate priority would be patient safety. I would assess the patient using an ABCDE approach. I would ensure the airway is patent, assess breathing and oxygen saturation, and provide oxygen if hypoxic. I would assess circulation, check vital signs, establish IV access, and place the patient on cardiac monitoring and obtain an urgent 12 lead ECG. Once the patient is stable, I would take a focused history and perform a targeted examination. I would manage the patient's pain and organize appropriate initial investigations, including blood tests such as troponin. Given the potential for a life threatening cause, I would also escalate early to my registrar. And if the patient becomes unstable at any point, I would initiate a med call. I would communicate clearly with the nursing staff, keep the patient informed, and document everything clearly. I've given you guys two samples how two IMGs would answer. And let's compare the two answers and see which IMG the interview panel would select. So let's think of just revise the first answer. If you were in the panel, would you recruit this IMG? I wouldn't. Why? No ABCD approach, no mention of patient stability, jumps straight into diagnosis and investigations, prescribes or like multiple medications without senior input, no escalation mentioned. Sounds like a typical textbook or exam answer and not real world practice. And this is definitely unsafe for a junior doctor level in Australia. How about answer number two? If I was in the panel, I would score higher for the second answer. And why? Prioritizes safety, uses ABCDE approach, shows awareness of junior doctor role, escalates appropriately, demonstrates teamwork and communication, uses a calm, structured approach, and also sounds realistic. Now that you have an idea how to structure or how to answer a clinical question, so I want to go step by step with you guys to formulate a standard framework on how to answer a clinical question. So, most of the time in an interview, you would get 1 or 2 minutes to structure the answer for your clinical questions. It is very rarely that they would expect you to give the answer straight away, but sometimes they would do that too. Because I remember in one of my interviews, I had to start telling the answer straight away. But most of the time, in the interviews, they would give at least 1 or 2 minutes for you to structure the answer. So, what is very important during this 1 or 2 minutes is just firstly understand, if they give a clinical scenario, understand where the location is, understand what kind of support you would have. Like for an example, if the scenario is in an ED and you are the scenario starts as you are the resident in ED, you know that you will have a lot of critical care support in the ED. But let's say if the scenario is given about a patient in the ward, it would be different. So at that point, there will be a situation where you would need extra hands or extra help. So understanding the location where you are is definitely important. So that 1 or 2 minutes is important to structure yourself. And I would use those few minutes to maybe think what my working diagnosis would be. And also, I would also think about few like 4 or 5 differential diagnoses that I will be working when I'm seeing this patient. So it doesn't matter what scenario it is. In a junior doctor interview, when you're answering a clinical question, always, always, always start with the ABCDE approach. So, this is the point that you get to show that you are a safe doctor. Okay, so what would you say? I will attend to my patient immediately and start assessing my patient using the ABCDE approach because patient safety is my priority. So I want to make sure that my patient is clinically stable. So in this at this point you can even elaborate ABCDE, but sometimes what I feel is most of the time when we start explaining the ABCDE, the answer might drag a little. So I wouldn't necessarily do it, but you can. There is no hard and fast rule, but if you think you should, you can say, I will assess the airway and the breathing and make sure the airway is patent and the patient is saturating well in room air. And if he's hypoxic, I will start on some oxygen, and I will assess the pulse volume, the pulse rate, and also the blood pressure. And I will assess the level of consciousness and also get the nursing staff to check blood glucose level. So you can um, elaborate the ABCDE like step by step, but you don't necessarily have to, because what they want to hear is that you're using the ABCDE approach to make sure that your patient is stable. So, following explanation of the ABCDE approach, your next step would be to mention the focused assessment and initial management. So, number one should be targeted history. So, your patient is coming with chest pain. So, what do you want to know more? You obviously want to know more about the chest pain. So, don't ask unnecessary questions. You only have to ask questions in regards to the chest pain. So you want to ask, when did the chest pain start? Where is it exactly? On a scale of 1 to 10, how would you grade your pain? How bad is the pain? And you want to know if it's radiating anywhere, any aggravating or alleviating factors. So focused history means this: your patient is coming with chest pain, you explore the chest pain. Don't ask like who is he at home with or what is his mobility at baseline. We don't care. We only care about the chest pain. So you already do have a list of differentials that you did maybe wrote down or you have in your head during those 1 to 2 minutes. So ask a few symptoms which definitely is needed to explore or to get an idea on what your working diagnosis should be. So next is the assessment. So you want to say, I want to do a focused cardiovascular and a respiratory examination. And then you have to mention about the initial management. So basically, what I mean here by saying initial management is, let's say, oxygen, or if you think the patient needs IV fluids, or get an IV access, and also getting the necessary initial investigations. So, in a patient coming with chest pain, you wouldn't want to say getting a full blood count, a CRP, kidney functions. No, you first want to do a ECG. So there's nothing like you have to tell the blood investigations first. No. So in a patient coming with chest pain, more than a troponin, my focus would be, my priority would be to get an ECG. So you want to say here that I want to get an ECG here, and also while getting IV access, I want to take basic blood investigations, including a troponin. And the next important point is that I feel like IMGs always tend to tell like a series of investigations whether it's relevant to the case or not. Like, for an example, a CRP. I don't know. Would you do a CRP in every patient? I wouldn't. I'm sure you wouldn't too. So, if you wouldn't do it in real life, don't say it in interviews, because what they want to know is if they know, if you know what you're doing. That's what they want to know. They want to know if you know what you're doing. So, don't just tell the investigations just because you have to. Tell out the investigations that you would do, which is relevant to the clinical case. Next step, escalation, which is very important. So, once you finish with your focused assessment and initial management, you want to say that you want to escalate. But it is very important to show that you know to whom you have to escalate. So, what you can say is that given my level as a junior doctor, I would want to escalate about this patient to my registrar. So I want to know if there's any additional investigations or any additional management that I had to do for this patient. So this shows that you know when to escalate about your patient and when to ask for help. The most important fact to remember here is that you don't want to start your answer by saying this. Please don't start your answer by saying, I want to call my consultant or I want to escalate to my registrar. That's not what they want. They want to know if you are able to assess a patient, make sure the patient is stable, do the initial assessment, and then take the initial investigations. And then, yes, then you can definitely escalate to your registrar. So, following escalation, you have to remember that communication and documentation is very important. If you have any additional steps that should be taken, you have to communicate clearly to the nursing staff, and also every single step that was done should be clearly documented. So when you finish your answer, you have to say that I will update the nursing staff who is taking care of the patient, and also I will clearly document all the steps that have been taken up to now, and if required, I will hand over to the next team as well. In interviews, more talking does not mean more marks. Overloading with textbook answers or drug doses or rare differentials is not gonna get you the job. So, all you need to know is understand how you have to make the interviewers happy. So, if you know the concept of answering a clinical question, any clinical scenario that they give, use this same approach and you would be able to make them happy. Let me tell you a few common clinical scenarios that you will get in junior doctor interviews: chest pain, shortness of breath, reduced GCS, sepsis, electrolyte abnormalities, unwell patient in the ward, postoperative fever. If you don't remember everything that I said, that's okay. But if you want to remember something, please remember, be safe, be structured, and escalate appropriately. That alone will put you in front of many other candidates. So I hope this was helpful. And please don't forget to like, share, or subscribe to my channel. And I am definitely going to bring you more and more information about my experiences and also about how I can guide you guys to get your first job here in Australia. So until I see you in my next video, take care.